The federal government of Nigeria, through its Minister of Health, Dr. Osagie Ehanire, has called on states at all levels to remove the embargo on the employment of health workers to eliminate the barriers to achieving universal health coverage in the country. He made a call at a ministerial press briefing to commemorate World Health Workers Week with the theme investing in the health workforce in Abuja. Dr. Ehanire said investing and hiring more health workers is paramount to improving the quality of service and healthcare provision, thus reiterating the need for personnel budgets of health facilities to be judiciously spent to meet the set targets. The minister noted that at the federal level, mechanisms have been placed to ensure the revitalization of more than 4,000 primary healthcare centers. Hence, states must follow suit to tackle the numerous health challenges facing the country.
The Federal Ministry of Health has an evidence-based and gender-responsive human resource policy and strategic plan to guide investment in health workforce. We are responding to issues of health worker migration by putting in place policy measures that ensure more health workers are trained, recruited, retained, and better remunerated. The ministry is also taking steps to elevate the human resource health branch to a program to be dealt with by emerging human resource for health issues in Nigeria. The Human Resource for Health Conference is planned to discuss many of these issues as soon as possible and to find ways to mitigate the challenges that are ensuing from lack of insufficient training and numbers of healthcare workers.
On his part, the director of the U.S. Agency for International Development, USAID Health Population and Nutrition Office in Abuja, Paul McDermott, calls for partnership in the training of health workers to effect progress in the sector. According to him, more commitment is required by the government of Nigeria to ensure deliverable health care to the citizens for universal coverage.
Health demands from emerging infectious diseases, many of them mentioned by the Honorable Minister, increasing conflict and migration, strained human resources, requires strong partnerships and greater coordination in action. This also requires increased government investment at all levels to train health workers, offer jobs with decent working conditions, and build the capacity of health workforce planning and management. While there is challenging work ahead, we recognize that investments in health workers not only improves health outcomes, but creates jobs and drives economic growth and prosperity.
The World Health Workers Week, celebrated every 7th of April, is aimed at building support for the future of the health workforce for frontline health workers in low and middle-income countries such as Nigeria, as nurses and midwives' unemployment stand at 41% produced in a session, while 95% of these professionals are willing to work in the rural community if given an opportunity. Vincent Okushin, QTV News, Abuja.